Well, over the last 10 or 15 years, we've seen a worldwide crisis in youth mental health. The situation's got rapidly worse during the pandemic. We call it the shadow pandemic. Every single country has neglected mental health care. The average spend of health budgets is about 2% of health budgets, when it's actually more like 15 to 20% of the health need. So the missing middle is a term that's gained a lot of traction in the public mind over the last few years. And we're talking about a group of young people who have problems that are too complex or too persistent for primary care services like Headspace. To get that responded to properly, you need a team of experts.
Headspace, when I first started, it was so vital for me because it was the central point I can go to for a GP, for a therapist. I reached my 10 sessions, and after that, I was just kind of left. The Headspace practitioners themselves told me that, you really do need more help, but we're really sorry, we can't do more.
A lot of parents of children my age are like, oh, therapy? What would you need that for? The first real obstacle that I had was around convincing them to let me go to therapy. After that, it was really just about finding someone who could actually help me with what I needed, which has proven quite difficult.
Physical disability is prioritised here. Mental health is prioritised right down here. So this is a massive, massive health issue which must be addressed. And so far we've seen either the rear vision mirror, or a bit of confetti, or deathly silence. That's not acceptable. The other key issue that has to be addressed is workforce. There's no point in announcing a whole series of centres or platforms of care unless we have the bandwidth widened for the workforce, and that has to be done urgently and across all disciplines. If that's not done, any announcement is meaningless.
There is no support for the missing middle, either because of suicidal ideation or self-harm. I would go to the ED and the ED staff would be like, you really do need help, but I also didn't really qualify to be hospitalized or be inpatient. And even when it did get to a point where I needed to be an inpatient, I waited probably a month for a bed.
It's really about sort of trying to target the missing middle specifically, or at least even start to acknowledge it and the fact that it's there. With the internet, there's certainly a lot of information everywhere, all the time. It can be quite difficult to sort of work out where to go and what to do.
There are two bottlenecks. First of all, even though we have Headspace, it's overwhelmed. There's a massive shortage of expert, skilled clinicians. Here at Orygen, we have 562 young people on the wait list for our Headspace centres. People can't get in to the first tier of care anymore. If they do get in, 2/3 of them do not improve because primary care on its own is not enough to help them recover.
What my friends talk to me about a lot and what I've heard consistently is primarily two things if you boil it down. One is the barrier of cost. Even if you can cover the cost and you've got through the kind of internalised shame and the community stigma around mental health, you go through the process of getting a mental health plan from your GP, for instance, there's a limited number of sessions.
We have seen a significant increase in signs of mental ill health. That's been exacerbated by COVID in the last couple of years, where we've seen a further increase. But it's a trend that has been in place for some time, which is concerning. We've got to design the systems, we've got to have the systems in place, but we also, of course, need the people to work in the system.
We know that if you're going to experience mental ill health, then the chance is that 2/3 of those conditions will have emerged by your 21st birthday and fully 3/4 by 25, which reinforces the critical importance of having services that cater for young people. And the truth is that over the course of our history, we haven't done that very well. When I was young, for example, really the expectation if we talked about mental health at all was that you'd see mum and dad's GP.
The blueprints are there. The government's endorsed them, in fact, community mental health hubs for adults. And The early psychosis platforms expanded for young people to back up headspace. We haven't seen any commitments to scaling them up across the whole country, which urgently is needed. We've lost maybe about, 8,500 from COVID. It's 35,000 from mental ill health. It's 5 million Australians every year affected by mental ill health. What we need to see is programs to build the missing middle.
Our new government should really be a representative government, as they're meant to be, and to do that, it really is about putting mental health at the forefront, because that is what the Australian public is doing.
I'm sure there are a lot of politicians out there who've spoken about what they want to do for young people and their mental health, but I haven't heard it. No one's really speaking to the actual young person. People are speaking to the parents or the practitioners. I think this is something a lot of politicians forget. You get voted in by maybe someone older than you, but the people who are going to come into the workforce are the young people. They're the ones who are going to continue to vote, so they're the ones you should be prioritising.